Hi Jules, welcome to 4C Crown of Glory. For this segment, you can call me Nurse Reid. So the stats for my surgery supplies video has been doing well. So I was encouraged to make this video. As you can tell from the title, I will be speaking about labs and medical clearance for surgery. To go ahead and get started, I just want to say, other than having elective surgery, I would hope that everyone gets checked up at least once a year by their primary care physician. So before even thinking of having elective surgery, you will be informed if you are well, borderline, or have a chronic condition such as high blood pressure, diabetes, thyroid issues, and etc. But before I get into all of that, I just want to encourage you all to become a jewel to this crown and help support 4C Crown of Glory by subscribing. You can also hit the post notification bell so that every time I upload, you will be notified. So let me first start off with medical clearance. So with medical clearance, think of it as like a checkpoint. You want to be cleared by your primary care physician. You would then have to be cleared for the specialist at the surgery center. And on the day of pre-op, you will or will not be cleared by the doctor that's performing the surgery on you. Well, with that being said, let me now get into the lab work. So just because you have a chronic condition does not mean that you cannot have elective surgery. You want to make sure that you work with your doctors to get your lab work as normal as possible. So the doctor at the surgery center is going to send your doctor a list of lab work and diagnostic tests that you have to have done before getting medically cleared. So 8 labs that I know that are important are a complete blood count, a basic metabolic profile, HIV test, PT, PTT, INR, thyroid, and HCG. I'm going to go into depth a little about what the most important labs I think are very crucial before having surgery. Other lab tests and diagnostic tests that your doctor may order are also the COVID test, an EKG, chest x-ray, clearance from cardiology, mammogram, or a breast ultrasound, depending on what surgery you're having, your age, and medical conditions that you may have. Most of these doctors also want to make sure that your BMI is 35 and under. As per Nurse Reid, not your doctor, the most critical labs that I think are most important are as follows. Platelets. Your platelet count is very important. Platelets are very important for blood clotting, so you want to make sure that your numbers are not too high or too low. Foods that can help with platelet counts are foods high in folate, iron, vitamin C, B12, vitamin K as well, but you want to be careful with foods high in vitamin K, as vitamin K causes blood clotting. Well, another critical or crucial lab is hemoglobin. Hemoglobin is a protein molecule in red blood cells that help carry oxygen from the lungs to the tissues and return CO2 from the tissues back to the lungs. Hematocrit is another important lab. Hematocrit deals with the volume of blood that contains red blood cells. So hemoglobin and hematocrit kind of works hand in hand, and you want to make sure that both of them are within normal range. For hemoglobin and hematocrit, just like platelets, you want to make sure that you have foods that are rich in folate, iron, vitamin C. So things such as liver, red meats, citrus fruits, shellfish, dried fruits, and green leafy vegetables. Apples are also great. For hemoglobin and hematocrit, you want to make sure that you avoid ingesting and taking medications that block iron. PT, PTT, and INR deals with how fast or slow your blood clots. Some medications and foods can slow down your clotting time, so it is very important that you check with your physician about taking blood thinners, NSAIDs, and some common foods and supplements that can potentiate blood thinning are turmeric, ginger, cayenne pepper, vitamin E, garlic, grapeseed, ginkgo biloba, almonds, echinacea, bromelain, and cinnamon. I'm going to get to something with cinnamon later on. Another test is hemoglobin A1c. So these are for my pre-diabetics and diabetics. You want to make sure that if you're on insulin, metformin, or any of those anti-diabetic medications, that you take your medication regularly, but let your doctor know that you're going for surgery and they can work with you. You want to make sure that your A1c level is less than 5.6. Ways that you can control your blood sugars are obviously by exercising. I say you work out 5 days a week for at least 30 minutes per day. You also want to go ahead and eat whole grains, your vegetables, some protein. And now back to cinnamon. I remember doing a research paper on how to lower blood sugars, and what I wrote about was cinnamon. It has been shown that cinnamon can be used to lower your blood sugar levels. But then again, be careful with how much cinnamon you're intaking. And you know that diabetes and hypertension goes hand in hand. So the next thing I'll be speaking about is your blood pressure. Although it's not a lab and more diagnostic, you want to go ahead and make sure that your blood pressure is lower than 140/90. If you're on blood pressure medication, make sure that you are taking your blood pressure meds. Make sure that you coordinate with your primary and your surgery doctor to find out if and when you need to stop taking it right before surgery. Control your blood pressure. Some things that you can do are just like with diabetes, exercise, of course. You want to lower your sodium intake. You want to drink plenty of fluid. And a tip that I know from my Caribbean background is lime water. Lime water is effective when it comes to lowering blood pressure. So please go ahead and do your research about lime water and blood pressure. Another lab test I want to speak about is thyroid. To get your thyroid normalized, you want to make sure that you are, of course, taking your medications if you have hyper or hypothyroidism. With hyperthyroidism, it's a good idea to introduce iodine into your diet. That can easily be found in certain shellfish and iodized salt. And with hypothyroidism, you want to make sure that you are taking your Synthroid or your levothyroxine, that's the generic form. And you know that medication is life-saving and crucial. Make sure that you let your doctors know that you are on Synthroid, and speak to your doctors about taking the Synthroid before surgery as well. And now I'm going to speak about HCG, aka the pregnancy test. I know, wait, none of y'all trying to be pregnant right before surgery or trying to find out that you're pregnant during your medical clearance. Although I truly believe babies are a blessing and God knows exactly when they're going to come into this world. But if you are doing elective surgery, you know for sure that it's something that you want to do. All I can suggest for your pregnancy test to become negative is, of course, test, I'll say, every month, right from the time that you know you're going to have surgery. Abstain from sex if you can. If you can't, use condoms and birth control as well. Speak to your doctor about when you can stop taking your birth control prior to surgery. Your kidney levels are very important. So your BUN and creatinine are some labs that your doctors are going to ask to be drawn. With this, you want to make sure that you are staying hydrated. Your electrolytes are also very important. And out of all that I've seen or researched, your potassium levels in particular are very crucial. You want to make sure that you are eating a balanced diet and be careful with high potassium foods. And another thing are the electrolyte waters. You want to be careful with that because those contain a lot of electrolytes. And if you're drinking those every day, 2 to 3 liters every day, that's just going to be building up in your body. High potassium can lead to abnormal heart rhythms. It's one of the reasons why you want to be careful with taking in too much potassium. Being that I am on the topic of heart rhythms, I want to go ahead and throw in EKG. I believe if you're over the age of 40, they will ask for an EKG. You want to make sure that your EKG says sinus rhythm. That is a normal heart rhythm. If you have a heart condition, of course, you know you have to be cleared by your cardiologist. Exercise regularly to keep your heart conditioned. And if you have a heart murmur, make sure that you notify your physician. All right, Jules, so I'm down to the last lab. The last lab that I have on my list that I feel like is important to surgery is, of course, white blood cells. You want to make sure that your white blood cell count is within normal range because risk of infection, you don't want to get no infection and then be unable to fight off the infection. So it's COVID time. Nobody wants to have the Rona right before surgery. Stay your behinds inside. You don't even want to catch the flu or a cold or anything like that, because viruses can lower your white blood cell count. And if you do have an infection, it is important that you treat it as soon as possible. So I'm talking about UTIs, the flu, upper respiratory infection. So with that, you want to load up on your vitamin D, your vitamin C, zinc, and it takes about 30 days for your white blood cell count to replenish. And that's it, Jules. These are some tips that I'm giving you to make sure that your lab work stays within normal limits so that you can be medically cleared for your surgery. And if you all are enjoying these type of informative videos, I want you all to go ahead and give this a thumbs up, comment in the comment section below, and keep me motivated to continue making videos like this so that I can use whatever knowledge that I have to help you guys have a safe and healthy surgery or procedure. And remember that these tips are not just for people who are having BBLs and tummy tucks. any type of surgery. You want to make sure that you're healthy as possible. I'm praying that you all stay blessed and wishing you all luck with your whatever journey that it is that you are on. And I appreciate you. Please don't forget to subscribe and help us out. And I will see you all in the next video. Bye.